What are the top 3 questions that they should be asking a plastic surgeon to see if they're a good one?
What size fits my frame?
Okay, what size fits my frame?
And then for the placement, they're going to recommend behind the muscle because that's going to help hide it. And that's, later on, if I or someone has to do the explant, that's a harder explant to do.
So do you recommend getting it in front of the muscle?
The short answer is a smaller one above the muscle, when the situation is right, is probably the easiest. You'll have a lot of people who don't like having implants right away after having them. And that's, can you imagine you built this thing up in your head and you go have it done and then you're like, oh my God, I don't like this.
Yeah.
Not easy to go and get a redo, a do-over.
And then the last question, if we're doing 3 questions to make sure your surgeon's going to be good.
Yeah, I always like folks with a lot of experience and some experience as it relates to cancer. We'll go out on a limb and say they're a little bit more empathetic and understanding, maybe not so quick to make recommendations without going through a pretty lengthy discussion. Anytime I had a cancer discussion that related to reconstructive techniques or what options we could have, those things hour and a half long. I think that's the issue.